for being here. We are very, very happy to receive Dr. Sebban, that she welcomes us in her Parisian clinic, and for our new webinar. So thank you, Dr. Sebban.
Thank you, everyone, and thank you for being here. I'm really happy to have you in Paris.
Thank you, Dr. Sebban. So today, our webinar will talk about the lifting concept with HA and with SoftFil micro-cannulas. So before beginning with Dr. Sebban, who will present us her webinar, I will present her very briefly. So Dr. Sebban, she's an aesthetic doctor here in France. She's an international trainer and KOL, specialized in the aesthetic medicine, and also she invented many injection methods. Sorry, she invented many injection methods and also very disruptive products. So I will quote some of them. So she invented the soft filling techniques in 2009, which is an injection method with micro-cannulas. She also invented in 2011 the one-point technique. Then in 2015, she created the SoftFil Easy Guide, which is a pilot needle. This device received. I'm really sorry. This device received an award in 2017 by l'Observateur du Design. And she invented also in the same year the stop facial aging method, which we'll talk about it today. And for at last, she invented the SoftFil Academy, which is a hyaluronic-based care for the side effects of the fillers. So thank you, Dr. Sebban. And one last detail, the SoftFil Academy was launched in 2021 and received 3 international awards. So congratulations to the Dr. Sebban. We will present very quick the summary of this webinar. So today we will present the stop facial aging method. Then we will describe the lifting concept, and we will do for the first time in the SoftFil Academy a live demonstration with our patient that we have here in the clinic of the Dr. Sebban. And afterwards, of course, we will do a Q&A session. This Q&A session, of course, you can ask all your questions in our Zoom. We will answer to them, and of course, we will answer to them during the injection or after the Q&A during the Q&A session. Please remember that our Q&A. Sorry. Please remember that our. I'm really sorry. Please remember that, of course, you will receive a replay in the newsletter, and you will have it subtitled in French, in German, in Spanish, and in English. Thank you, and now we will go to Dr. Sebban. Thank you.
Thank you, Soraya. So now I'm so happy to present you this method that you can use every day in your office, because I do that since now, I think 6 years or more than 6 years, because it's for me the way to go back in the aging process. Because when you have a patient, whatever is the patient, a woman, a man, every kind of indication, and if you want to treat your patient and to restore the volume lost with the aging, it's very easy to follow this method. This method was really launched in 2017, at first in Poland and after in France and everywhere in the world. And this method was awarded in 2020 in a big congress in Monaco, international congress. And of course, I published scientifically this method in the GK journal. You will see that after in other slides. This method is very easy because it can, propose you a very rigorous and reproducible methodology. Of course, this is a method who can help with the volume enhancement, and of course, in order to restore all volume of the face in different layers, anatomical layers, meaning the bone, the fat, deep and superficial, and the subcutaneous fat. So we will work in 4 dimensions with cannulas, with HA, with very maximum safety, minimum pain and trauma, and you will see it in the live demo, and of course with a very harmonious and natural result. So now I will propose you to show you, of course, how we can work with this method. We will work in different layers, as I told you. The first layer will be the bone structure, because you know that when we go to the aging, of course, when we become old, the bone is reducing its volume. You know that the temples are losing the volume and the projection. The cheekbone are losing, of course, the projection too, the chin, the mandibula. So we need to restore this volume with the adapted product, an HA, very adapted to the bone structure. And second step, we will restore the fatty layers. So at first, the deep layer, the deep fat, and after that, we will restore the superficial fat. And at the end, I will show you with another injection with an adapted cannula, an adapted product, the subcutaneous fat. So you see here the slide will show you the different layers of the face, and we will be exactly on those layers, and I will show you at the end that it was proven in dissection and in different kind of MRI. So now this is the publication who was described exactly during the year 2020, and I was exactly describing this method as 2 steps. So at first I will inject the deep layer, and after the superficial layer, because for me, if you are injecting only the deep layer, you will not be perfect and the result will not be harmonious. So you will see on our patient very interesting result. Now you can see on this slide that all indications are included in this practice. So you can work on men, women. You can work in aging patient or young patient. You can work with a different ethnicity, and you will see that the quantity is of course proportional to the indication. So, for example, if I have to treat a very deep patient, with a very maximum loss of volume, I will inject many quantity of product. And if I have a young patient, of course, I adapt the quantity to the indication. Of course, 4 levels of injections, and I will restore all the fatty layers and the bone and the skin structure. So now you will see on this QR code, if you want, you can of course go on the QR code and you have the publication, sorry. So now here you can see on this slide what I offer you when I propose this method. It's the lifting concept. Why? Because you know that, of course, on the face we have many fat compartments, and of course when our patient is relatively young, I think I can go until 60 years old. And because now you know that we can treat many patients until 80 years. So I think until 60 years old you will have a very good result, because all compartments are very, you know, stretched together. And when I will inject one area of the face, I will lift the adjacent zone, as you know. So for example, when you see this slide, you can see the scaffolding on the left picture, and you can see the anatomy on the right picture. So if you want to imagine a concept of scaffolding on the face, you have to divide the face in two parts, the left hemiface and the right hemiface. And if you want to imagine the anatomy, you have to divide one hemiface in 12 small divisions, 3 in the upper compartment, or the upper part of the face, the upper third. We have 3 on the lower third, and the others squares are in the middle part of the face, the mid face. Why? Because you see that all squares are exactly the reflection of the anatomy. I mean, for example, you can see the fat, the forehead, and all compartments on the forehead. You can see, for example, you know, the temporal and lateral compartment in the lateral part of the face, and you can see, of course, the jaw fat, exactly the reflection of the square that you can draw in the lower part. In the middle, you see that all squares are the reflection of one compartment, the deep compartment. So you see, of course, as you see on the picture, all compartments are close together, and of course, the younger you are, the better lifting you will have at the end. So you can see on my patient, you will see the result of the lifting concept, meaning when you are injecting the upper face, you lift the lower face, of course. Now I have imagined many, you know, not many, but few axes and few lines, just to show you how to be safe. For example, you see on this slide one oblique line coming from the inner canthus of the eye until you see the anterior border of the masseter. This line, the oblique line, is the reflection of what you can imagine when you see the facial vein. And of course, if you are inside, I mean, you know, below this safety line, if you are inside, you are, of course, in danger with your patient and with your injection. But if you are outside, I mean up from this line, this safety line, you will be very safe, because you are far from the main vessels, far from the facial artery, far from the facial vein. Of course, you have to decide where you will inject the product on the bone, and where you will inject by the entry point. Your entry point will be located exactly on the crossing between the oblique line that you can see on the slide and a line that I have described coming from the commissure of the lips to the earlobe. This line is the center of gravity of the face. And if you want to know where to put your entry point safely and very strategically, you have to go 5 mm up to the oblique line and this mid-face line. So this is a crossing between the, you know, here that you can see the two lines that you can see on the slide. And another axis, very interesting, coming from the nasolabial fold, you see the nasolabial angle to the tip of the helix. And if you draw this line, you have a very beautiful rejuvenation axis, and it helps you to be a good artist. So now the next slide show you